Good morning and a very warm welcome to Bonitas House Call here on SABC2. Mafrika borwa ke re ka tima go taboga yaka. I'm Dr. Victor Ramatisile. Nna no loksitsa ngaka ka tlung. Le tla ngwana ha Saturday se seng le tsoa le mashomara ro re fereletse hora ya borobedi useng. It's amazing how many of us do not understand or agree on what stress is, and yet it appears to either cause or aggravate many medical conditions. But what is clear, however, is that our bodies are under the influence of the nervous system, one part of which is the voluntary or the central nervous system that controls all the function and movements that we make consciously. The second, and our main subject of discussion today, is the involuntary or the autonomic nervous system that is in charge of breathing, heartbeat, sweating, bowel movements, and many other functions we do not control. And all of this speaks to the relationship between our minds and our bodies and the psychosomatic disorders that develop when there's an imbalance in this equation. But as I said, stress means different things to different people. But let's hear what the experts have to say about this matter. Let's watch.
Stress is a strange word. It is used both to describe the reaction to pressure or problems, and also to refer to the things that cause pressure or unhappiness in people. So when people say I have stress, they mean they are experiencing it. But also we as medical practitioners, as doctors, as mental health care workers, look at the effect that pressure is causing on them. And we call that stress also. So it will be stress-related problems. Our bodies and our minds react to stress in the same way. You have something that bothers you, a co-worker or a supervisor at work, or a condition in the environment where you live, making you very unhappy. And it makes you unhappy, you can accommodate it for some time, but at some point something is going to break. Either it's you that breaks, or it is the cause of the stress that is breaking, or you actually accommodate it and live with it. So that is the nature of stress.
Hey, supervisor, I like that part. Don't forget to join our discussion by calling us on 083-913-4687 on stress and your health, or you can send your SMSs to Bonitas 33723. We've also invited into the studio Dr. Jan Shabalala, who's a specialist psychiatrist, as well as Dr. Craig Golding, specialist physician at the Advanced Integrative Medicine Center, as well as Dr. Colinda Linde, who's a clinical psychologist. Colleagues, thank you very much for joining us this morning. Very interesting subject. I mean, we're going to have to sink our teeth into it right away. Now, let's not go far. Dr. Shabalala explained, stress in various ways. I know that you guys in psychiatry call it psychosocial stressors. But what we need to emphasize is what I said earlier, that you have the autonomic nervous system, which controls those things that we are not in control of, our breathing, our heartbeat, and all of those things, which when we are confronted with a threat or anything that threatens our bodies, the body must get ready to either fight that threat or to flight. And I remember Professor Wayne Demon did justice to this subject when he was giving evidence during the well-publicized Oscar Pistorius trial. That what happens, among other things, that when the body gets ready to fight, the heartbeat must go up so that it can supply blood to the muscles so that they can flight or fight. The muscles must get tight. The blood must rise, blood pressure must rise, and all of those things that must happen. And of course, blood must move from those areas that are not going to be critical during the flight or the fight, such as your gastrointestinal tract, your sexual system, and all those things that are useless when you're fighting or flying away. So what happens is that in normal situations, there are those things in our lives that create the same type of environment, and the body therefore gets ready to fight or flight when there's no need to do that, but the body reacts to a stress. Now, what are these psychosocial stressors that we are talking about?
Yeah, there are many and varied. Like you said, when we say stress, we describe a situation which forces you or puts your body or your mind at the level of discomfort, where you have to pull out from your reserves in order to cope with the situation.
Correct.
So
And all of this is not under our control.
some of it is,
Okay.
some of it is, and some of it isn't. And I'm saying some of it is because we talk about the stress technique, techniques to cope with stress by yourself, which means some of it you can actually control. Let's say, for example, something happened, and we teach people to say to themselves, what is it going to do to me? Is it going to kill me? No, it's not going to kill me. It's going to make me uncomfortable, yes. Let me breathe slowly, and relax. Some of the relaxation techniques can actually help voluntarily.
Just hold it. Before we go to all those techniques. Now, as a clinical psychologist, what is your interest in psychosomatic disorders or some of those bodily conditions that are caused or that come as a result of stress?
Psychosomatic, if you think about it as mind and body, obviously there's a massive underpinning of stress. So if you suppress emotion, it's like keeping a sneeze in. It's got to go somewhere, and it could come out in the body, or sometimes in the form of anxiety or depression. But I just want to say, if we look at stress, there's a very interesting equation you can think about, and this is what underpins stress. So if you think about demands this side and resources that side, this is like a balancing act, isn't it? So it's what you brought up and what Jan was saying as well, that there are all these demands this side, and when you don't have enough coping resources that side, and I know we'll talk about resources later.
Balance that we are talking
yeah,
about.
and psychosomatic is one way
And the
in
body
which that can
begins to have
happen.
some form of problem.
Yeah.
Now, Dr. Anaga gave some examples. So in our normal day life, stress is what we experience every day. When you wake up in the morning, you are rushing. It is normal. It is only when it is prolonged, I guess, or at what point does it begin to cause problems in your body?
Yeah, stress is good. And I want to say it. Stress is good for you because stress gets you to get up and do something.
Yeah.
It gives you the drive that is needed. It's when it's excessive and when you can't cope with it, or when you can't organize yourself in order to cope with the demands of the day, that's when you break down and your defenses crumble.
Hold it there, because now we're going to get Dr. Craig Golding to tell us exactly what happens when the body breaks. But let us hear more about how the body reacts to the stress from Dr. Ranaga again.
The stress causes psychological problems, and the psychological problems happen in a body, in the soma, in the body of the person. So we begin to then talk about psychosomatic signs and symptoms that occur as a result of stress and as a result of your reaction to the stress. Stress will affect the brain, will affect the heart, will affect the stomach, the gastrointestinal, the intestines and the stomach, and will affect the bones. It will affect all parts of the body, and then it will also affect your mind to the extent that you can become very depressed, become very anxious, and unfortunately all of these things are all linked up from the brain right down to the body in such a way that when you have stress, which is as a result, let's say, of changes at the workplace, changes at school, changes in your relationship, changes in the politics and the economy, all of these things affect you in a sort of a comprehensive way. Don't be just the brain or the mind that is affected, it'll be the heart and all other parts of the body that are affected. The common presentations of stress, the common things that we see as stress are anxiety, where you are always scared, you are shaking and it's like you are afraid all the time. Depression, that is when you are continuously under threat and you fear that things are going to go wrong in your life, then you become depressed, you become hopeless, helpless, and you feel that you're useless and it's probably better that you be dead. That's depression. And then so-called generalized anxiety disorder, that's part of anxiety. And other aspects of stress are the post-traumatic stress disorder that I talked about, which is ongoing and quite disabling. And it's actually an occupational disease for policemen and military people and ambulance workers and so on. And other forms of presentation of stress are asthma. You can have allergic reactions as a result of stress, where the skin just breaks out in rashes and in itchiness, and that is as a result of stress. And the other aspects of stress are anger, frustration, aggression, all of those are also as a result of being under stress, and that is how you as a person are reacting to the stress.
We still have to visit that issue of policemen and family killings and suicide and all of that. Now, Dr. Craig Walding, you're a physician. Nobody walks into your room and says, I've got stress. Usually when they come to you, what do they say and how do you assess that this particular headache, this particular backache, this particular skin rash is not that it's just happened on its own, it has got stress associated with it?
Well, we normally, take a thorough history to start with. So some people do volunteer the stress, or they volunteer the symptoms that they're presenting with. For example, sleeplessness or weight gain, or as you say,
weight gain,
tension
That's
headaches.
scary. Okay.
So they give you clues, but I always ask people what kind of stress they're under, and I ask them to try and give me a score. If they had to score 1 out of 10, what is their stress levels? And it's quite alarming how much stress people are under these days. I think most as practitioners are seeing more and more patients with it. I think important to note though is it's how people react to stress, not just the stress per se, because the way they react to stress will obviously result in different effects on the body. For example, if you're under prolonged stress, a lot of the acute symptoms have been mentioned here, the fight and flight, the blood pressure, the blood perfusion, diversion that you mentioned. Those are the acute effects, of adrenaline elevation or your sympathetic nervous system being activated. But if you have prolonged stress, your adrenal glands, the little glands on top of your kidneys, produce too much cortisol. And that cortisol has a lot of effects on the body that are deleterious to your health. For example, it elevates your blood sugar, increases insulin resistance and weight gain, can cause breakdown of your bone. It's a catabolic hormone.
So this is what Dr. Anga was explaining, because you would say stress and the bone almost, remote, but yeah, okay.
Bone breakdown. It suppresses your immune system.
Yeah.
So you're more prone to infection and
so
allergies.
So you get colds and flus much easier if you're under stress.
Allergies, even cancer, because your immune system is affected. Normally when we use cortisone in medical practice, we use it for its anti-inflammatory effects. But when you have prolonged cortisol elevation, because of the fat accumulation and the stress on the body, you actually have a pro-inflammatory effect, which then leads to a whole host of diseases: diabetes, heart disease, cancer, memory loss, all these chronic inflammatory disorders. You can even start getting arthritis and degenerative conditions. So prolonged stress with the result of elevated cortisol causes serious consequences.
So this cortisol is actually a counter, but it does have its normal functions. It is
we
useful.
need it. It's an essential hormone. We need it for survival.
Yeah.
And as the good doctor said, stress is good. We need to do that to get up and go and accomplish our
But if
daily
it's
tasks.
prolonged for too long, this cortisol really causes a lot of problems.
A lot of problems.
Scary stuff. Awuqawumsuthu wakhala are elokhekho iyayingwaya noma kuthiwa ngesizulu umuntu unovalo entanyeni okweselesele kusuka kuchaza ke isimo esifana nalesi. We'll continue our discussion on stress and your health. Hanganga re khutle papatso haramathembu. Welcome back. We're watching Bonitas House Call here on SABC Mtakamaw. Sihlabela phambili mhlabela mgama ngengodlwana ndlebe lethu namhlanje. Kule ngxaki esithetha ngayo ebandakanya ingqondo nomzimba wena okanye psychosomatic disorders njengoba sitsho ngolimi lasemzini. Now let us watch exactly how these psychosomatic disorders or stress on your body is being managed.
When we come to the management or treatment of stress, we have to remember that the causes are multiple, so it's a multifactorial condition. Stress is, so even in the management of it, you have to approach it from that level, that angle. That it's not just a matter of me as a doctor giving you tablets. I have to do psychotherapy, or I must refer you to a psychologist, an occupational therapist, a priest, a social worker who's trained to do that. Some traditional practitioners are also able to do that. So all of these people get involved. There's going to be a need for medication. Yes, the medication that we do use for a short time in psychiatry is the so-called benzodiazepines, which are anxiolytic anti-anxiety medications, but we don't encourage using them for more than a month. So we switch over to using antidepressants, which also have anti-anxiety effect. And examples are escitalopram and citalopram and fluoxetine. All of these help to reduce anxiety, but they also, fortunately, also reduce depression. And then going on to other aspects of medication, we can reduce the rapid beating of the heart, the pumping of the heart, with so-called beta blockers if necessary, and that is also when the blood pressure is a bit of a problem, when it is racing out of proportion, and it can predispose you or cause you to have a stroke. Then we also ensure that your nutrition is improved, because there are nutritional supplements that improve your wellness, reduce your anxiety levels, and that ensure that your body is properly nourished, so that when next you experience stress, the body is ready to do the fighting and the running and the fleeing. Treatment of stress is medical, but what we can do for ourselves is to exercise, reduce those things that worsen our condition. Alcohol is no good, and even smoking, some people use it to deal with stress. It's no good because it has its own very bad long-term side effects. So the best thing is that when you've got stress, or you expect it or experience it, let's say at work or at school, approach your supervisor, or if he's causing the stress anyway, go and see your general practitioner, your doctor. He is the best place to assess you, and then I think he'll have the good sense to refer you to a psychologist or a psychiatrist or an occupational therapist, who will then deal with your stress on a professional level.
Very, very intricate when you look at the relationship between our bodies, our minds, and our social environment, and how all of those interact to lead to a certain type of disease. But then again, when you are confronted with a patient, Dr. Golden, with a headache, you give them tablets, the headache doesn't get better. There's always an assumption that if a headache does not respond to your normal treatment or analgesic, then there could be a stress related to it. Is that the way that we should look at backache, body ache, or any other type of pain in the body? If it does not respond to your normal painkillers, that you should begin to suspect that it could be caused by stress in one form or another?
Yes, I think so. I think, there's obviously typical type headaches that you can, sort of classify and then treat appropriately. So you get cluster headaches, for example, which are of neurological origin, usually on one side of the face, around the eye, with a bit of puffiness. These tend to occur, on the same time and quite regularly. So you can identify a certain type of headache. That headache is quite easily identifiable and treatable, sometimes difficult to treat. And then you get vascular type headaches, which are migraines, throbbing type of headaches, sometimes with visual symptoms. You get tension headaches, where you have pain on the sides of your temples. That's very often related to stress. So some headaches are quite typical of a particular type of headache. But I think if you have chronic body pains, as you've mentioned, back, body pains, especially sometimes associated with fatigue and headaches, then stress one should really have a look at. And cortisol and these stress chemicals like adrenaline and norepinephrine and so on, they can be managed with lifestyle techniques, as has been mentioned, also with the benzodiazepines and the SSRIs, the antidepressants. But there are also some very, very valuable nutrients that help manage cortisol. The one very strong group is a group of natural medicines called adaptogens, herbal adaptogens. These are
supplements that you can buy over the counter?
Yes,
okay.
These are plant extracts, plants that have been living in a difficult environment, for example, on a mountainside where the weather changes can be quite harsh. Ashwagandha is a classic example, rhodiola is another one, Laura is another one. I love ashwagandha. I put a lot of my patients on ashwagandha because it just helps regulate cortisol.
And they tend to replace some of the stuff that you lose as a result of stress in your body.
No. They basically regulate your cortisol level. So they're very interesting. These adaptogens because they're of plant origin, they need to be flexible. So when your cortisol is low, when you're burnt out, for example, it will elevate your cortisol, and when your cortisol is high, it will suppress it. So these are very useful to keep
So
your
in
cortisol
spite
in
of the
check.
stress and the effects thereof, you can then get some of those
Instead of grabbing
supplements
the-
that can help regulate your cortisol levels. in
Yes,
other words.
exactly.
I see.
So those are very useful. And then you have nutrients like phosphatidylserine, vitamin C, pregnenolone. So there's many natural medicines that can help manage
I want to
your
come
cortisol.
back to this issue of natural medicines, but because it does cause a bit of confusion, because we know it's not a one-size-fits-all. And the issue is that how do you then determine that these are the type of supplements that I should be using to manage my stress or to minimize the effects of stress in my body? Now that maybe Colinda cannot help you with dealing with stress. But the question that I want to ask is that not the same things will cause stress on the same people. Now, what makes people different? I mean, you see sometimes in funerals, people who are pretty much bereaved families. Some people are crying and wailing all over the place, and one of them is just stoic and you also don't even know whether they understand what is going on. Another one is smiling about when it is people who are affected by the same bereavement in the family. What determines to the extent to which you are going to react to the stress and how it is going to affect your body?
Sure, we could talk for a long time on that,
I'm
but
sure
I'll
we
try
can.
and restrain
I'm sure we
myself.
can, yeah.
Okay, so one concept is control, and the other one is permanence. I'll talk about these two because anyone can relate to these.
Yeah.
So if we're looking at control, and this is something we know but we forget. So, and it's really simple. In any given situation, if you actually focus on what you can control, then you're going to be so much better. But what do? We focus on what we can't.
you can't control.
So what can you control? Yourself right now. What can't you control? The past, the future, other people, weather, traffic. So what do we try and control? The wrong one, okay? So that's a simple one. So in any given
Always
situation,
focus on what you can control.
always, and typically that's yourself right then. And later on we can do some techniques like breathing and so on, I'll show you. But there's a lot that one can do for yourself, okay? Number one, the control appraisal. So attached to that is the permanence, impermanence concept. So when things are going right, we want them to actually be like that forever, don't we? You know?
Yeah, it's normal.
And then when they go wrong, we kind of, what happened? And then we have this complete misconception that, well, why is life going so wrong? So, and when things are going wrong, what do? We think, well, this is never going to get better. You know, this is it forever. So that causes
There's a
a lot
sense
of
of
stress.
helplessness that comes along.
But this causes stress if somebody doesn't look at the really big picture. Because, you know, we do tend to do that when things are going wrong, we often magnify that this is my life, everything is bad. So we need to always look at the good and the bad together, but we tend not to. And a lot of stress is about these two factors.
Yeah.
Believing in things being permanent, good or bad, and not looking at control where we should be.
Interesting. But before I go to an ad break, will stress cause high blood pressure? Will stress cause palpitations? Will stress cause heart attacks?
Absolutely, because they're talking about the autonomic nervous system that you referred to earlier. It's this system that reacts to situations sometimes even before you're consciously aware of them. You know, and it works through the ACTH adrenal axis, where again the cortisol comes into being, and it just secretes, and then the palpitations, adrenaline drives the heartbeat drives the pressure. The pressure gives you elevated blood pressure, and in some cases hypertension itself.
You hear quite often a location, Memas Mamang, he was never the same, and she died soon thereafter, getting a stroke or something like that. Is it possible that, you know, some of those major cardiovascular accidents, you know, your strokes, your heart attack and whatever, can be precipitated by acute stress, a death in the family, loss of a job and those kind of things?
Absolutely, Victor, because that serves as a precipitating or a worsening effect in maybe a pre-existing condition. That happens quite frequently, Victor. We know that because the body and the brain and the mind are inseparable. You know, what affects the one is likely to have an end effect, and the body bears the brunt.
And the gut also can get ulcers because of stress?
Sorry?
Ulcers because of stress?
Ulcers, yeah. Look, these are medical things. You've
No,
got to
I'm
ask the
asking you
medical guy.
deliberately.
But what I can say, I mean, it's exactly what Jan was saying. And Craig, you've been saying the same thing. That any kind of imbalance is going to play out somewhere, isn't it? You know.
We'll be joined by somebody who's living example of the effects of stress in the body when we return. You stay with us. Welcome back. You're watching Bonitas House Call here on SABC2, and today we're discussing stress and your health. Wena umakoti ukhulela kodwa kungaphumi lutho mase kufika isikhathi sokuthi ayobeletha aza ntshontshe ingane esibhedlela ngoba esesaba ukubuyela ekhaya phela engaphethe indlamafa yakwamkhize. Wo uyakwesaba ngcindezi. Now we are joined by Mr. Richard Honky, who is a patient who's going to tell us a little bit more about his personal experience. I was introducing them and I talked about women who fall pregnant for 9 months, they go to labor and nothing comes out, and they end up even stealing a baby from hospital because they had a false pregnancy, a condition you guys call pseudocyesis. Do you want to describe what happens?
Yeah, quickly. This is a false pregnancy on people, ladies who are expected to be pregnant, and after some time they manufacture the pregnancy and have all signs.
And all subconscious. They don't do it deliberately.
No, they
it's
don't.
All subconscious.
They don't. Yeah. They have all signs and symptoms of
They
pregnancy.
feel body
The nausea.
Yeah,
everything. But then they don't go into labor, you see, because there is nothing. I mean, labor is something else, you know. They may have, some signs of labor, but not real labor. So they believe they're pregnant, despite everything to the contrary. And some of them end up in our ward, where we have to talk with them, send them to psychologists and deal with them, the pregnancy. And you must remember, this is they're holding on to the pregnancy as a way of fighting the stress of expectation from the in-laws usually.
Half the time.
Yeah.
And that's why they end up stealing babies in the hospitals.
Yeah, unfortunately it comes to that, and then this is an unfortunate phenomenon.
Interesting. How are you?
Very well, thank you, Doctor.
Now, I'm happy that you're well, because the reason you're here is because you're not well at some point.
At some point, yes. I became a victim of stress, and I think one of the key things that the doctors have covered very well today are the various different ways that stress manifests, and also how it manifests differently with different people. And I think one of the things that happened to me is I didn't realize how stressed I was, or all the symptoms that I was experiencing over many years weren't actually normal. One of the things you start to get used to having a headache 3 times a week, getting colds and flu every 4 weeks. You blame it on the air conditioning system in your building, being tired all the time.
We're very good at finding a reason for all of these things.
Indeed. Being tired all the time. Well, we work hard, so it's obvious to be tired. Being negative and cynical. Well, listen to the news. How easy is it to be positive when there's so much negativity around?
You spoke about things that we can control. So
Indeed,
very interesting.
Indeed. And a lot of the time, if you're not aware of yourself and your own reactions to these things, they start to become a habit. And you start to become used to it. And also, the doctors have also spoken about how prolific the prevalence of stress is. So you talk to your colleagues and your friends, and half of them feel the same way you do. So you think, well, this is normal. And you carry on. In our society, which is so high-paced and fast-paced, and almost in some ways, some of our urban culture rewards stress. Look how stressed I am, that means I must be working hard.
It's fashionable.
It's fashionable, absolutely. It's a badge of honor.
Yeah.
So over many years, this accumulated until my body eventually just said, look, we've been trying to tell you
to do something
and you haven't done anything.
And what happened at that point, quickly?
Essentially, I went from being a highly functional individual, so I was achieving a lot of things. I was fairly grumpy. And sort of miserable.
And we all at some point.
Well, there we go. So I didn't think anything was wrong. And over a very short period of time, I went to someone who became completely non-functioning. I couldn't get out of bed. I was diagnosed with burnout, and even the dreaded D word, depression, was used. And my ignorance and arrogance around concepts of depression were things, well, I don't get depressed. How can someone like me get depressed?
Hold on.
I'm successful.
Just before you tell us that, now, is it normal or is it common where you find a lot of us, even when we are stressed like him, we don't want to accept it. We think it's a sign of weakness to admit that we are stressed or even depressed.
I've got to be careful because I'm here with many men.
No.
But I think men are socialized that we're strong, we're powerful, we can do anything. So I think it's particularly it's difficult for men especially to acknowledge this. We typically, a woman goes to the GP and she's stressed. Here, have some pills, pour you. The guy goes to the GP and he's stressed. Pull yourself together, man, and get on with it.
I see.
So I think it is much harder in terms of societal norms as well.
Was it burnout syndrome?
Sorry?
What is describing? Is it a typical burnout syndrome?
Yes, definitely. Protracted stress eventually leads to adrenal exhaustion, and then you can't produce your steroid hormones that you need to function. And then you literally can't get out of bed. And I've seen this many times with
Because
patients.
of your cortisol levels?
Because of protracted, prolonged years of stress. And then your cortisol and DHEA levels, for example, drop quite significantly, and then you can't function. That's why we said in the beginning, you need a bit of stress. You need those steroid hormones to function.
So
Once
this
they're not
cortisol,
there,
under stress, it goes up a little bit, but under prolonged stress, it begins to drop.
eventually it drops and you get
And when
burnout.
it is too high, it is problematic, and when it is too low, it is also problematic.
When it's too low, you're non-functional.
That's when you call burnout.
Yeah.
What treatment did you get eventually?
Well, I believe in my GP and the biological approach to medicine. So I eventually sought a specialist, and once I realized that actually meant seeing a psychiatrist, I had to get over my own stereotype views of what a psychiatrist is. A psychiatrist was what I've seen in the movies, but all a psychiatrist is a specialist in these areas. So I was put onto medication to get the certain levels of neurotransmitters and cortisol and these kinds of things right. I engaged in a type of psychotherapy to help me understand that much of the stress I was causing, I was actually causing myself. So again, the doctor spoke earlier, specifically Dr. Linda, around how we interpret the world around us. And you asked the question yourself, Doctor, around why do some people at a funeral react differently? Why can I come on this show today and talk to you and be quite invigorated as opposed to feeling so nervous and nauseous? So based on many different experiences in our lives, our skill sets, our belief system, our values, we interpret the world and the stimuli that happen to us in different ways. So our autonomic nervous system will react in different ways to different stimuli. So for me, understanding the way that I was viewing the world, I'm a very, to sort of summarize many years of psychology and psychological study and medical study, I'm what's known as a type A personality. So I am very driven, I'm a perfectionist, I'm impatient, I'm a control freak.
I don't want to work for you, that's for sure. But hang on, just at that point, are you on any treatment for now?
Not at the moment, no, other than lifestyle treatment and yes, being conscious of it.
Hold on there. This thing, psychotherapy, counseling, every time when I was working in Tembisa, you tried to refer patients to psychotherapy. Have you found that in Africans particularly, that there's quite a resistance towards psychotherapy, and maybe because the effects are not immediate, or what are the issues here?
Yeah, generally in Africans, the concept of psychotherapy is fairly new. People don't understand how you can go. I remember I sent one guy to a psychologist, and she said, "Doctor, why did you send me to that lady to talk with me? You could have told me the same thing."
I know, yes, yeah.
So I think we need a more a different approach.
Yeah.
It's pretty much like I'm just reminded of the IQ test. The kind of IQ tests we're doing are standardized for certain populations. They don't work well in Africans. So I think we need a certain different approach. Not that psychotherapy is not needed. Hell, we need it.
No, we know we do, but we just can't practice it properly.
Yes, but what I found works a little bit is sometimes to start, because the purpose of psychotherapy is to stimulate the inner awareness and awake the inner resources of a person, make the person aware of the strength
So they can
that they
function on
have.
their own. Like it's an excellent example. Now he can function on his own without any assistance.
That is
whatsoever.
the crux of psych. But then in the African approach, it's a little bit different. Sometimes you ask them what is called rhetoric questions that want them to ask themselves, but sometimes it doesn't quite sink in our people. And I'm not saying they're dull, but it's in terms of our cultural approach.
What do we replace it with? How do we deal with issues where psychotherapy would have? Because there's got to be a replacement for it.
You modify it. You modify your approach according to the sophistication of the person that you're dealing with. Okay, according to what the cultural experiences of that person is. If the person is sophisticated, I mean, like Daki from Santen, for example, you can't see them the same way as a person from
No, it's
the
true.
rurals.
Yeah, but another issue also is during bereavement, the typical African thing of people sitting on the mattress and people coming in and they relate to this event repeatedly. It is some form of psychotherapy.
Absolutely,
absolutely. And we don't
absolutely.
realize that it is, but it is part of our culture. So we do have this psychotherapy.
And we actually do have group therapies, but in African settings, in a
Yes.
different way.
Yeah.
What you're talking about is actually group therapy, right?
Yeah.
The wife of the deceased usually gets aunties and friends around them.
Yes,
They
correct.
talk and laugh. That is group therapy. They do not approach the subject of death directly, bang, in the face.
Absolutely, yeah.
You know?
So we do have ways.
Yes.
Nangesizulu kukhona amaqhikiza intombazana mayisakhula khona abadala bamayalelayo bamtshele ukuthi bameluleka ukuthi enze izinto kanjani. Kanti in other cultures ufana uthola ama-professionals to help with that. We'll continue our discussion with stress and your health after the break. You stay with us. Welcome back, Monis. Bonitas House Call SABC2E. And today we are talking stress and your health. Now we have an SMS here, Dr. Shabalala. Can sleeping tablets like tryptylin help me cope with stress?
Yeah, there are various sleeping tablets out there, but tryptylin is essentially an antidepressant.
Okay.
It will help you with stress, but I just want to talk to all those people who are using sleeping tablets for stress. It's like drinking alcohol. When you wake up the next morning, the stress is still there.
Yeah.
And I think it's better to deal with the underlying causes. As doctors, we are taught to deal with the cause rather than with the effect. So using sleeping tablets is really dealing with the symptom and not the cause. And all those people who are using sleeping tablets are actually making idiots of themselves.
So you have a stress that causes depression, and too often people who are depressed, they say they've got stress, when in fact there's a psychosocial stress or somewhere.
Yeah.
Loss of a job, financial problems,
Yeah.
relationship problems,
Yeah.
that leads to some form of depression. So we shouldn't have a confusion between stress and the effects thereof.
Definitely.
Now you had something to advise us on exactly how you have managed with your stress over the years.
One of the things that I realized is the doctors have explained it very nicely in terms of the connection between our brains and our bodies, and that our brain is just another system of the body. And I think a lot of people maybe don't understand how powerful it is in terms of how we think about things, how it can affect us physiologically. And this is where I come to in terms of talking about the self-awareness about stresses and how you react to them. Yes, you need to be equipped to react to them, but how you think about things can fundamentally impact your physical and mental health. So a non-medical example is something like, imagine thinking about your favorite food. Your mouth will start watering. Yeah, so it's not just Pavlov's dog that used to do it. We can think about food and our mouth can start salivating. We can have an erotic thought and certain physiological reactions occur. We don't need to go into that. So the power of how we think about things and how we frame it, which is in our control. Again, as Dr. Linda said, these are things that are in our control. A lot of the time, it's much easier to say, the stress is caused by the environment, the stress is caused by my boss, my supervisor, the stress is caused by my husband. They may be a source of stress, but at the end of the day, there has to be a responsibility about acknowledging it and how you deal with it. So you need to learn how to take that responsibility. And sometimes, when you are so worn down, it's very difficult to do that. And that's when it's important to seek the help of people around you.
That's when you need all the vitamins and the supplements that Dr. Craig Golding so ably told us about this one. So how do you cope with the stress? What is the best method of coping with stress? Assuming that you cannot remove it, assuming that you cannot change the traffic, those things that we cannot change, that we said we shouldn't concentrate.
I think you've heard from all of us that it's how you think about it, number one. Number two, you've alluded to that, is support, getting as much support as you can. And I'm sure it's at the moment, it's on the screen, sadag.org. You know, the SADAG is a call center where you can get lots of support, telephone counseling, and they can refer you. And then a very quick exercise I'm going to show you now. Okay, so anybody can do this. So there is a medical explanation, but this is what we're going to do. So if you've got a squeeze ball, you can squeeze that, or just squeeze anything. So you're going to be squeezing as you breathe in, and as you breathe out, you're going to breathe out like this. So when you breathe out slower than when you breathe in, and I'll demonstrate it, and we can all do it if you like. So you breathe in and out like this. very slowly. When the air hits this place, it triggers the parasympathetic response, which is your calming chemicals. So that's all you need to remember, and it drops your blood
It's
pressure.
like the people who count up to 10 when they're
No,
confronted.
you can just breathe in,
Yeah.
say, for 5 seconds as you squeeze. If you're driving, squeeze the wheel. Anything, a squeeze ball, not a person, but squeeze something. So breathe in for about 6 seconds, pause, and out very slowly as you
I'll
release.
try it at home and I'll tell you if it works.
Right.
Excellent stuff. Now, I said earlier, people don't walk into your rooms and say, I've got stress. They come with various conditions. Some of them, they've been treated by a general practitioner and then they get referred to you as a physician. 5 common conditions that you confront that are as a result of the body reacting to stress. What are they?
All right, well, there's so many. Let's look, for example, at another epidemic that we're almost seeing at the moment, breast cancer. There's no doubt that stress is one of the major causes of breast cancer. And in fact, studies show that people who have or ladies who have a lot of stress, their breast cancer is more aggressive. So remember to manage the stress when you're managing the breast cancer.
Sure.
That's one example. Another classic one is fibromyalgia. Stress often leads to these chronic fatigue, chronic pain type syndromes. And there I try and manage the stress rather than just give painkillers. So you manage the stress, the adrenals, the serotonin levels, get the neurotransmitter levels balanced, the adrenals sorted, and so on. Another one that we often see, particularly in men. Men don't like to go to doctors, but they do if they have impotence. If they have erectile dysfunction, that will take them to the doctor. And often you'll find that there isn't a vascular problem. Sometimes there isn't even a testosterone problem, but it's rather a chronic stress, psychological.
So there's no diabetes, there's no
There may be.
hypertension.
Many of the
Yeah.
patients do have that, but there's a subsection who have that somatic effect of a psychological
And you're not
issue.
going to treat those with Viagra. You've got to have to give them something else.
The Viagra will help, but it won't be the the end all of the treatment. You're going to need to
still have to deal with the stress
you need to do some psychotherapy and stress management with them as well. Sometimes you find in them, for example, that their cortisol level is very high, which suppresses your other hormones, by the way. So then they can present with erectile issues and just no desire,
And the last two?
lack of libido. Chronic fatigue is a big one. We've all experienced chronic stress. What often happens is you cope. The male ego doesn't want to admit that he's taking on too much. He carries on, and then eventually the stress
Last one
leads to
quickly, we
burnout.
run out of time, yeah.
Any degenerative problem, so any inflammatory condition, cancer, diabetes, arthritis, osteoporosis,
Recurrent
osteoarthritis,
flus and all, yeah.
recurrent infections, any chronic degenerative problem can be caused by chronic stress and the effect of the brain on the body.
Yeah, did you know? Hey, guys, mo khaungile bora mediro ya rona mo mosong wa gompieno re weditse re so fela o ithutile go le gontsi tebang le botsalano ba stress le maletse a mmele kgotsa stress and your health ka Seesimane. We'll round up our discussion when you return. You're watching Bonitas House Call here on SABC2 and welcome back. Some Mushudella Ganabe Brajan, what is your key message that you want to?
My key message, Bravita, I want to address myself to men, my kind. It is okay to be stressed and depressed. And when you do feel that way, instead of going to drink and smoke and assault your wife and your kids, go see a professional, go and see a doctor, tell them everything. We're professionals. We're not going to laugh at you. We're going to help you. So men out there, when you're feeling stressed and things are not okay, look for help. In fact, looking for help, Victor, is a sign of strength rather than a sign of weakness.
Well said. Professor Henry Saftiad is very notorious maybe, but very famous for saying vitamins and supplements are useless. You can get everything that you can get from them in your body. All they create is expensive urine. But do you have a different view on the role that they play in managing stress in our bodies?
Very much so. It's not just about vitamins and supplements. It's also about nutraceuticals, adaptogens, things that you can use that are very beneficial. So what we do in practice is we quantify the amount of stress that you're under. So for example, you can do salivary cortisol measurements. You can do DHA cortisol ratio measurements. So you can check on saliva, blood, or urine, quantify the amount of stress. Then if you have a very high cortisol, you can use adaptogens, phosphatidylserine, vitamin C, pregnenolone, and so on to try and lower the cortisol. And these are very, very effective. You don't have a medicine that can elevate something that's low and lower something that's high. You don't have that in medicine, but adaptogens in plants you
will
can
help
use.
you regulate.
That helps regulate your cortisol, and they are extremely effective. Much more effective than a medicine to regulate cortisol.
Okay,
And
that's all
just
the-
one more thing for the brain. You know, if the brain is very excited or excitotoxic, wired and stressed, there's very, very helpful nutraceuticals like theanine and inositol and GABA. There's many
work
things
on
that
the
are very,
brain.
very effective
Okay.
as an alternative to the benzodiazepines that we were referring
Okay,
to.
quickly now, you have a book to recommend.
Yes. Richard will murder me for this, but he's written a book called Life Less Lived. And
He's written
yes,
it, okay?
And I'm very pleased he wrote it, because for all the ladies out there, read it, pass it on to the men. For all the men out there, if you think that burnout and depression is for other people, read the book, Life Less Lived.
One word of advice.
No man is an island. Reach up your hand, as Dr. Shabalala said. Seek help. There is a lot of support out there. We've spoken a lot about how prevalent stress is. The great thing about that is we know a lot about it now, and we know a lot about how to treat it. And there are a lot of things that you as an individual can do yourself. But
Thank
seek
you
the
very,
help.
thank you very much to all of you today. We've run out of time, but certainly we'll have to visit this subject before the festive season, because there are various times of stress that are going to visit us during the festive season. Barnabas, Rosadi Beamalatsa, Rosadi Getzam Hatakuti, Iteditaba, Zemanati Hadifele, Isidikukuzalinyan. We'll be back next Saturday with the health advertising. Whoa. So don't miss it here on SABC2 at 8:30 in the morning. Arkopaneng Hape, Bekenitra. Tato Hailamre. Thanks for joining us today. For me, Dr. Victor Ramoresi Ramatisere, Kim Ramaguapan, Kenamanetsa, Kim Tangwamletsa. You take care.